So welcome to HiNZ 2018. I'm Pat Kerr, and I'm here this morning with Lloyd McCann. Now, Lloyd is the Chief Executive Officer for Mercy Radiology and Clinics, and he's also the head of digital health for Healthcare Holdings. And Lloyd's given a couple of really interesting papers here at HiNZ, primarily all about digital transformation in the private health sector. You gave one on perfection and inaction are the enemies, and how our healthcare organizations must digitally transform, and then also one on hybrid cloud and health. So first, Lloyd, tell us about Healthcare Holdings.
Thanks for the opportunity, first of all. It's a great conference and a great organisation. You know, HiNZ is doing amazing stuff for digital health in New Zealand. So Healthcare Holdings Limited is our parent company. So it's essentially the holding company that oversees a number of complementary private healthcare organisations. So some brands that people may have heard of are Mercy Ascot Hospitals, Mercy Radiology, Auckland Radiation Oncology. So we're a big group of complementary healthcare brands. And I guess what makes us unique in the New Zealand private component of the healthcare system is that we're able to look after a patient across that care continuum. So if you need surgery, we have a hospital. If you need radiology, we are a radiology provider. If you need radiation oncology, we've got a radiation oncology provider. So we're quite lucky, I think, in the sense of the way we're organised and structured, in that we're able to offer an integrated or value-based service for patients. We operate across the Greater Auckland region, but we actually see patients from all over the country because we're one of the few providers, again, in New Zealand that offers a tertiary level of service. So we have an ICU on site, an HDU on site. We work with over 300 specialists, leading specialists across the Auckland region. So yeah, that's a little background on who we are and what we do.
Now, in terms of digital transformation, so basically, and one of the things I know many of us in health informatics, there's a lot of focus certainly on the public health sector, and I think that we underestimate really what is going on in the private sector. So it was really good to hear, and we've got a number of the private providers here at HiNZ this time coming along into the health informatics arena. Yeah. And you all are doing quietly and doing things. So tell us about the digital transformation that you've got underway.
Look, I think it's a really good point that we make this differentiation between the sort of public component of the sector and the private component of the sector. And I use that language quite deliberately because I do see us actually as one sector. So most of the clinicians that work within our component of the system actually work in public as well. Patients flip between different components. So people will have obstetric ultrasound scans with us, but actually deliver their babies in the public component of the sector. So one of the things we as New Zealanders probably need to get our heads around is that there's one health system, one health sector, and it's almost irrelevant from a patient's perspective where the care gets delivered. What that patient expects, what the consumer expects is high quality care wherever they are, and digital plays a huge role in actually enabling that seamless journey for a patient across different care settings. Just one more point on that, I guess, as well. So if you look at elective surgery within New Zealand as an example, 50% of the elective surgery in this country gets done in a private organisation. So whether that's funded by ACC, funded by a DHB on an outsourced contract, or privately funded through insurance or out of pocket, 50% of the surgery gets done in the private component of the sector. So again, I think that kind of border or that delineation is quite artificial, and what patients expect is a seamless journey. So I think you make a very good point that in the private component of the sector, there's a lot that's happening in the digital space. I think the challenges and the drivers for moving towards more digitally enabled care are the same, again, irrespective of whether you're in public or in private. And a lot of it for me is driven by two big drivers. One is consumerism. So if you think about how we consume services in other parts of our lives, so whether it's travel, whether it's banking, retail, we can do most things digitally these days. And we can do most things using and asserting our control around those systems we choose to interact with. Healthcare is a little bit different. So we've been talking about being patient-centered or consumer-centered or citizen-centered for decades. We're not. We're not at all. We're still incredibly provider-centric. So one of the key drivers, I think, driving digital transformation is that this is no longer a good enough position for us to be in. And patients, consumers will demand a certain level of service and a certain level of convenience and access because they get it in other parts of their lives. So why should they not get it in terms of their healthcare? The other big driver for me is around this notion of value-based care. So we define value as the outcome that gets achieved for a patient divided by the cost of that episode of care they go through. And because things are becoming more expensive, because people are living longer and we've got an increased chronic disease burden, if we continue to operate in the same way, I think things become unsustainable. So we need to shift our focus to delivering the best possible outcome and an outcome that matters to a patient for the lowest cost. And so that's what value-based care drives. And I think digital health, digital tools and digital approaches helps us to deliver value. So we can improve the outcome, but deliver that care at a lower cost. So that's, I guess, some of the why behind what we think is driving digital transformation and why healthcare organizations need to digitally transform.
If I could just say, one of the quotes that you gave, which I made note of, and you said, our health, hearts, and heads are in the cloud. So that's one of your key strategic goals, isn't it? To work in the cloud. So perhaps you can tell us what you're doing
in that space. Yeah. So again, I think we're a little bit behind the times in health. A lot of other organizations have moved operating systems into the cloud, applications and operating systems into the cloud. So, if you look at what you're able to achieve by moving from a traditional on-premise model into a hosted model, it's quite significant. So the example we talked about here at HiNZ this year was utilizing Microsoft Azure Stack provided by our strategic cloud partner Umbrella and working with another third party called Akiso. We were able to stand up a BI platform with advanced machine learning driving some of the insights that got delivered from that platform in a 3-week period. Mm-hmm. So that's just not, it was just not possible for us to even consider or contemplate doing something like that using a traditional on-premise model, working with vendors in the traditional way. But because we have that infrastructure set up there, ready to go, and I guess the team that wraps around that know what they're doing, they're able to mobilize very quickly and get us access to the resources we need quite rapidly. Utilizing that, drives huge insights and huge pace. So we're actually able to realize value a lot quicker by using a cloud-based platform and approach as opposed to the traditional model. The other interesting thing, if I link it back to the value equation, is the cost has also come down for us because we've shifted from the traditional heavy investment up front. You need hundreds of thousands of dollars in CapEx and then ongoing maintenance and support. Now we pay for what we consume. It's a consumption-based model. It's all OpEx, and so it's much easier to get a business case across the line as well.
Mm-hmm. And how do you deal with the it's gradually disappearing. The skeptics talk about the security of information, patient information, medical, clinical information in the cloud.
Sure.
How are you managing that?
Look, so I think we've always been very risk averse in health. One of the other things I sort of talked about was I think our appetite for risk needs to increase. But this is one of those areas where I think the risk is almost overplayed, or conversely, the risk in terms of the way we currently operate is underestimated. So a lot of people will say paper is safer. I relate a story. I used to work in the NHS in emergency medicine of a consultant colleague of mine who one day, because he wasn't sure that he was going to get case notes in time for a clinic he was running, put all of the case notes into the boot of his car for the weekend. So what I often relate is that cloud security and storage is probably safer than boot security and storage. Because, I guess the point is with our existing systems, whether you're talking about paper or even on-premise IT solutions, very similar vulnerabilities exist in terms of security or access to that data when it's in a paper format or as it relates to on-premise systems as well. The other key point here is if you look at Microsoft and Umbrella, the guys we work with, this is core business for these organizations. It is highly, highly important that their systems are up and running, secure, because they've got a number of customers globally utilizing these systems and utilizing their applications. So it pays for them to have things that are secure, things that are reliable, things that work at a high performance. So I think we just need to shift our frame around that conversation slightly. There's always going to be risk in whatever we do, but I think the risk is overplayed around some of that cloud security and storage issues.
Would it be fair to say that because you perhaps have more control in the private sector through healthcare holdings, that you can be more fleet of foot, perhaps in moving your systems, your PAS systems, the electronic records, perhaps more so than in the public sector? And if so, then how does that integration, if we're looking at it as a holistic view, how do you see that playing out?
So I think it's a very good point. I think we do have the ability to move slightly more quickly and be a little bit more agile. The interesting thing, though, is we do operate within the same regulatory framework. So, you know, we're still accountable for that data and the safe storage and the security and all of that type of thing. We still need to be able to connect into the connected health network. So we actually operate within the same regulatory frameworks. So to some extent, I think you could almost see it as a bit of an excuse. We are smaller, no doubt about that. You know, DHBs are dealing with acute and elective workloads, so that does bring an extra degree of complexity into the way systems need to operate in that environment. But I think it just requires leadership to have slightly more of an appetite for risk and take bold action and take some bold steps to move things into environments that are going to save money, that are arguably more secure, and that are going to deliver better outcomes for patients. In terms of the interoperability question, I think this is one of the key reasons we actually need to move systems off-prem and into the cloud. It allows us to be more interoperable. So again, if we come back to ultimately why we all exist, if this is about making things better for consumers, then our decisions and our actions should drive towards making things actually better for consumers. So yeah, I think the cloud gives us a huge opportunity actually to solve some of those interoperability problems we've been talking about again for decades.
So what are your next steps in terms of deploying the cloud strategy?
So we've got some infrastructure that's stood up and we're utilizing it now, the 3-week project I told you about. The foundational piece of work is moving our PAS and EMR into the cloud, as you talked about. So we will be, I think, the first organisation in New Zealand to have an integrated PAS EMR that's hosted. So that's a pretty significant move and something that we're obviously applying quite a lot of focus and effort on. But I think just having that capability there, again, like we've shown with this BI and augmented intelligence, advanced machine learning project, is you can do things very rapidly, very quickly, and realize benefit very early on. So we're looking at a number of other areas where we'll leverage that infrastructure to deliver some quick wins for our clinicians, for our patients, and help the organisation to deliver value as we've talked about.
That's great, Lloyd. Thank you so much. I did actually also talk to Dave Howden yesterday, and he talked a bit more about the 3-week project and the business intelligence, the benefits, and the sources where it came. So we look at the two of them together and get the full picture. So wish you the very best of luck. And Mercy, thanks so much for coming along. We appreciate it. And your full presentations and slides will be on the HiNZ website.
Thank you very much.
Thanks, Lloyd. Thank you.